Hello, it is very nice to see you. Come on in and take a seat. My name is Lee and I'm the medical assistant that will just be getting your history, taking your blood pressure, and identifying what brought you into the OBGYN clinic today. How are you doing? Good. Do you mind confirming your first and last name for me? Yep, I got you right here. And is this your first time at the OBGYN clinic? All right. And can you confirm your date of birth for me? All right. Just gotta ask you a few questions. Any medical history that we should be aware of? Are you on any medications right now? No medical history, but you are on a birth control pill? Okay, and how long have you been on that pill for? About a year, okay. Any issues with that pill at all? You were hoping for some refills today? All right. I will let Leanna, the PA, know. As far as surgical history, it looks like in the system all we have is tonsils from a previous provider. Would that be accurate? Any other surgeries that you've had? No? Okay. Do you smoke at all, whether it be marijuana or cigarettes, or do you drink alcohol? All right. And as far as family history goes, anyone in the family with breast, ovarian, or uterine cancer? Okay. And what about cervical cancer or colon cancer? Okay. And are you currently sexually active at all? Okay, and have you ever been before? Male, female partners, or both? And would you always use any form of protection or barrier method? Okay, and any history of ever contracting any form of sexually transmitted infection? Okay. All right, so it looks like for the appointment list today, they had you under an annual exam. Have you ever had an annual exam at the OBGYN before? Yes, so let me explain that to you. So an annual exam at the OBGYN is basically comprised of 3 parts. We usually start with a breast exam, just to make sure that the PA doesn't feel any lumps, see any skin changes, or anything concerning. Then she'll go ahead and press on your belly for the abdominal exam. Then the 3rd part, of course, is optional but recommended, especially if you're active, is what we call a pelvic exam. And a pelvic exam is exactly what it sounds like. It's essentially examining your pelvis. So we're taking a look at the outside vulva area, making sure we don't see any suspicious moles or lesions. They're inserting a speculum, and the speculum would be used to look inside of the vagina, make sure everything looks healthy, make sure there's no signs of infection. And then we're also able to see your cervix. Now, because you are not 21 yet in the US, you will not be getting a pap smear today. A pap smear is the name of the test for the cervical cancer screening. So we'll be doing the pelvic exam. If you want, which we do recommend, we'll do a swab to screen you for gonorrhea and chlamydia or any other infections you may want. And then we end the examination where she will have a glove on and put some lubricant on there, and it's basically called a manual, where she just makes sure that she doesn't feel any enlargements on your uterus or your ovaries. Are you okay with a pelvic exam today? Do you consent to that part? You're okay with that? All right, and I will let her know that. Are you having any vaginal concerns today? Okay, urinary, any burning when you pee, peeing more often? All right, and any pelvic pain? Okay. Do you know roughly how tall you are? Okay. If it is okay with you, I am just gonna wanna get some blood pressure on you. Perfect. Yeah, so you can just keep your legs flat. I am just going to wrap this around your arm. This is just going to go around here. Does that feel snug for the most part? Good. All right, so let me just grab the stethoscope. And I'm going to stop talking just for 1 second. Alrighty. Blood pressure is good. Take that off of you there. Alrighty, I'm gonna put your blood pressure into the system here. And then if you wouldn't mind, I'm just gonna collect a urine sample from you in case Leanna the PA would need it. Do you think you'll be able to pee? Awesome. Let me put that in. Let me write your name at the bottom of the cup here. So I'm gonna leave this cup for you on the counter. You take your time. Once you leave the urine sample, you're gonna come back in here. And then once you're in here, you can keep your top on, but you'll take off your bra for the breast exam. And then you'll get completely undressed waist down. I am going to leave a drape on the table there, the medical table there for you, so that you can kind of cover yourself, and then Leanna the PA will be in to do your annual exam. Oh, yes, and did you want the STI screening today? You did? All right, so this will be the swab that she'll be using, okay? Awesome, it was very nice to meet you, and she will be in shortly. It is nice to see you. My name is Leanna and I'm the PA that will be doing your annual exam today. So we are going to be starting with the breast exam if that's okay with you. Awesome. Very good. All right. I am just going to put my gloves on here. Do you have any questions or concerns before we get started today? You're okay? All right, so I am just gonna lift this one first on this side. You're just gonna feel my hands here, just kind of like a circular motion. And you let me know if anywhere I press causes you pain or discomfort. And I'm just making sure I don't feel any suspicious cysts or masses. And you haven't noticed any nipple discharge or anything like that? Good. Would you mind lifting just this arm here? We're going to look under the armpit. Good. I'm not feeling any suspicious cysts. There's no swollen or inflamed lymph nodes at all, so that's great. All right, I would say this breast exam for your left side was completely normal. I'm going to go ahead to the other side. All right, and I am just going to lift right over here. You let me know if you get too uncomfortable, of course. Very good. Again, I'm not feeling any cysts or any masses. Not seeing any skin changes. changes or inflammatory changes at all. Now, normally we recommend doing a self-breast exam once a month, usually a week after your period. And if you ever notice anything suspicious or any new pains, you just let me know. And if you wouldn't mind lifting this arm up, we're just gonna look under the axillary area. Again, making sure there's no inflamed lymph nodes or anything like that. Perfect. Just want to make sure they both look symmetrical on both sides. Alright, and then I am going to cover you up here. While you're in this position, I am just going to press on your abdomen, okay? Awesome. You let me know if anything I do causes you pain. No pain there, right? Good. What about in that area there? Still okay? Awesome. And I'm not seeing any concerning skin changes, no redness or inflammation. So everything as far as the abdominal exam is good. So what I'm just going to do is I'm just going to switch your positioning a little bit here. I'm going to need you to scoot your bottom all the way to the edge of the table, and then we will get your pelvic exam going, okay? So here, let me help you out. Alrighty, so it looks like you're in proper position. Very good. Doesn't look like we'll have to adjust you at all. The only thing is I am going to take these little feet part out for you just to rest your heels on. So we'll start with this side here and this side here. So if you just want to take this leg and put it right over there, perfect. And if you want to take that leg, I'll sort of direct you here, right over there. Excellent. So for the first part of the pelvic examination, I'm going to start by looking on the outside only. Would that be okay with you? All right, you are going to feel my glove here at your thigh. All right, so basically we're just going to be looking at the outer labia, making sure I don't see any suspicious masses or lesions, no cysts or redness. And you, of course, just verbalize with me if anything that I'm doing is uncomfortable. And no history of hemorrhoids, right? Okay. Any pain when I touch here? What about here? Here? What about here? Nothing here, right? Very good. Alrighty, excellent. Now, for the outside exam, everything looks absolutely normal, okay? Yes, so the next part is the internal pelvic exam. So we are going to be going in with what we call a speculum. Speculums can either be plastic or metal. So for here they are metal. They are warmed up usually, lubricant is put on them. And the way they work is we basically insert it into the vagina. We open it up just to see the inside, identify your cervix. We will lock it in place to do any necessary swabs or testing that you may need, and then we'll unlock it and then pull it out, okay? It definitely looks a lot scarier than what it is. What I usually tell people is if you've been sexually active before, this is probably going to feel very strange and uncomfortable, but it shouldn't be causing you pain, and if it does, just let me know. Okay, awesome. So let me get this warmed up for you. Alrighty, awesome. So what you're gonna do is you're gonna feel my hands on the outside here. You're gonna feel some internal pressure now. Alrighty. Inside of the vagina looks very healthy, no abnormal discharge. We're going to do that screening for you today. Gotcha. You may feel a little bit of pressure in there from a cotton swab. And of course, again, you let me know if you feel pitching or pain, but we will get this done very quickly for you. Very good. Swab 1 is collected. We'll just do one more swab and you should be good to go. Second swab is collected. I am going to take this out for you. Oh yeah, yep, for sure. Okay, speculum is coming out. Still doing okay? Awesome. The last part of the examination is what we call a manual exam, where I basically put lubricant on my gloves and I just feel for any masses or tenderness. Are you okay with that today? Okay. All right. I'm going to feel some internal pressure again. Any pain on that side? Okay. Pain here at all? Good. What about this side? No pain, and I'm definitely feeling no enlargements, which is great. All right. You are all done with your pelvic exam. We'll get you covered up here. I heard you need a script for your birth control refills. Have your script here. They should be giving it to you in a 3-month supply every time you go in. So they should be giving you 3 packs at a time. There will be enough refills on this to last you the full year. Of course, if any questions or concerns, you just let me know. So I will give the script for you. You can hand it to the pharmacist, okay? Absolutely. And then I will just see you next year. But of course, you come in sooner if any concerns or questions. Just know that with annuals, you are never forced to have a pelvic exam. So although it's great that you consented to one this time, if next time you're not having any concerns or anything like that, no one can ever force you, okay? Yes, yes. Let me push this in for you. And then I am going to give you some privacy. You can get dressed, and then Lee, the medical assistant, will see you at checkout. My pleasure. Have a good day.